Hi, I'm Gregory Holmquist. I'm a PharmD specializing in pain management, hospice care, and end-of-life care. I've been involved in this world for about 20 years and definitely see a big problem when patients on pain meds. I call it the pain of the pain med, constipation. And for years we've tried to work around this issue with a variety of laxative approaches, everything from Senokot, Docusate, saline laxatives, and so forth. And in the end, some patients get good results and a lot of patients do not. And what we've discovered is over the last few years is that we now have a unique drug with a unique mechanism for a unique form of constipation from opioids. We know that the opioid is extensively bound to the mu receptor in the brain, hence analgesia. But we also know that the opioid is extensively bound in the bowel. And when it's bound in the bowel, it creates an abnormal state that is different than other forms of constipation. We change the bowel, the peristaltic movements. We change the bowel by changing the fluid reabsorption out. We change the bowel by changing the secretory glands. And so hence we create a stool that's not moving well, that's becoming very hard. And one more thing is the patient's defecation response isn't there. What happens is that they become basically full of feces and don't even realize it until they become very distended. It becomes very painful. Now in the past we would try to work around this, a variety of options, and ultimately the end result was many patients had to be disimpacted. That is probably the worst thing that could be done to any patient, is being disimpacted. Sounds like a simple term, but to describe it would create agony for anybody. So currently now what we have is a new, basically, product that specifically targets the mu receptor in the bowel. It's called methylnaltrexone, trade name is Relistor. When given to patients who have opioid-induced constipation, the average patient has a bowel movement in under 4 hours, in spite of the fact they've had no bowel movement, perhaps even for days. Some of these patients even have a bowel movement in minutes. This is a true life changer for them. Why? Well, guess what? When you're constipated, it's painful, it's affecting your life, and it's making things pretty darn dangerous. Colonic extension can lead to colonic, basically, bowel necrosis. Well, that's more than a minor inconvenience. So this drug Relistor came on the market. It's available as a sub-Q injection. It works safe, it's effective, no drug interactions, and when patients utilize it, they discover now that their pain med is no longer the showstopper for them with constipation, that they can keep taking their pain med and they will no longer have that constipation. I think the biggest issue though right now is a lot of patients don't want to talk about constipation. What they're saying is everything seems okay because they don't expect it to be better. We need to raise the expectations, have patients talk to their providers more about constipation, but also have the providers talk to the patient more about their constipation. Ask the right questions. Not just, are you constipated? Because that's a quick answer, yes or no, yeah, no. But ask the other question, how difficult is it now for your bowels to be moving? Is it like it used to be? And when the answer becomes no, it's becoming harder, the stool, it's becoming more difficult, and it's not like it used to be, then it's really an opportunity to move away from the old ways of dealing with constipation, which are ineffective, to a new way, which is methylnaltrexone, Relistor, which specifically targets the mu receptor in the bowel and is the only drug that will hit that mu receptor effectively.